Hello, my name is Angie. I will be part of your nursing care team for today. Can I get your name and date of birth? Let me just go ahead and verify. Okay. Mrs. Jones, I have an order to remove your dressing and take some measurements and then get a specimen. Do you have any pain right now? No, okay. Have you ever experienced any pain during dressing change? Okay. If at any time you feel uncomfortable, have any pain, please let me know and I will stop. At this time, I'm going to ask you to please lift your arm up for me. The bed is already at a comfortable level for me. I'm going to go ahead and expose you. Privacy has already been provided. Okay, at this time I'm going to go ahead and remove your dressing, okay, Mrs. Jones? Okay. So at this time I'm noting exudate amount, color, consistency. I'm noting if there's any odor. And then I am assessing the borders, making sure if they look regular or irregular, if there's any edema or redness around, and I am assessing for warmth as well. I would have also checked for maceration. Again, assessing for drainage, odor. I'm looking at the wound bed, seeing if there's any granulation, any slough or necrotic tissue. Are you comfortable, Mrs. Jones? No pain at this time? Or any pain at this time? Okay. I'm gonna go ahead and take some measurements. Okay, at this time, I'm gonna check for depth. And I'm making sure that I'm going to the deepest. Looks like it's here. Okay, and now I'm gonna go ahead and check for tunneling. sure my irrigation tray expires in the future, that it's sealed. I already did my checks for my sodium chloride, which is my normal saline. Go ahead and open. I'm gonna go ahead and remove. I'm gonna go ahead and pour after I did my verification. Okay. At this point, you might feel some cold water, and it might be a little cold, okay? But if you experience any pain, please let me know. I'm going to go ahead and irrigate it from top. Okay. And I'm irrigating it until it's clear. Okay. Okay. So we're almost done, okay, Mrs. Jones? Are you doing okay? Okay, at this point, I'm gonna go ahead and make sure my culture expires in the future. That's intact. I'm gonna go ahead and open it, removing my Q-tip sterilely, and I'm gonna go ahead and do the 10-point zigzag. I'm gonna go from one end to the other, and then I want to really make sure I'm getting in the tissue. It could be a little uncomfortable, Miss Jones. I'm gonna go to 10 points. Okay, now with my tube on one hand and my Q-tip on this side, I'm gonna make sure I uncap it, and then I'm gonna tilt, carefully making sure I don't contaminate, and then slowly close it, make sure it's labeled correctly. I'm gonna go ahead and remove. Are you feeling okay? Do you have any pain at this time? No. Here's your call light. Lower that at safe level. And at this time, I would clean up my workspace, and I will document my measurements and how the patient tolerated the dressing change, and the characteristics of the limb bed. And that's it.